So platelets, thrombocytes, acellular component of blood involved in coagulation. Okay. So thrombocytes, what platelets are? Thrombocytes. Okay. Thrombocytes, acellular component of blood which like helps in coagulation. Right? What is coagulation? It's a clot formation,
Clotting
right?
formation.
Clot formation. Yes, good. So these involved in the coagulation, this clot formation. So what happened? Clump together to achieve a hemostasis. Hemostasis is stopping blood. Hem is blood and stasis is stop. So is stopping blood clump together to achieve this, and platelet plug will be formed, and this agglutination will be there. Okay. What is agglutination? This is like a serological response to a specific antigen antibody, right? So, play essential role in bleeding control, maintain integrity of blood vessels. Okay. When injury occurs, platelets collect at the site and are activated, right? What happened? This is like they are explaining here that how it works. These plays very essential role, these thrombocytes, when like in the like play very essential role in bleeding control, like to control the bleeding, maintain integrity of blood vessels. So when injury occurs, platelet collects at the site and are activated. What like if any trauma, any injury occurs to our like in our body, on our body surface, if bleeding occurs, what happen? They will they will collect at the site of and they will activate. Because they will activate, they will form a plug formation, right? And they will ultimately stop the bleeding. They adhere to the site and to each other, forming a platelet plug, right? That temporarily stop bleeding, and then what happened? They activate the coagulation factors. You know the coagulation factors, right? We will study it further. So they activate the coagulation factor in the blood plasma and initiate formation of fibrin, a filamentous protein, right? Understand? This is how it works. These thrombocytes, they ultimately help to stop the bleeding. So the normal lifespan of the platelets are 7 to 10 days. Understand?
Yes.
If you will say yes, understand, I will ask you a question. Please let me, Kavita,
Yes,
understand here.
yes, ma'am.
So what is filamentous protein?
मैम आपने ऐसे पूछ
You said no, understand, then I
Ma'am,
can
I
ask you
understand what
any
is a
question.
platelet, what is the action of platelets, what is the lifespan of the platelets. And
Okay. This is easy na, Kavita. I will ask you any tough question.
and some of the clotting
Filament,
factors.
like Kavita, what happened?
Yes,
Na, I
ma'am.
will ask you if I will ask you anything like you don't know. This is good. If you don't know, I will explain you. So this is how you can know. You will come to know whole slide. What is there?
Yes,
So
ma'am.
in next
But
time, if anybody will ask you any question, you can say big yes. Yes, we know everything.
no,
Right?
ma'am, I understood, but little bit because this is the
Yeah,
important
I know.
things I understood, and some of the
Yeah.
clotting factors also.
Yes, yes. So filamentous, actually it's not like the word is here, that's why I'm explaining. Filamentous proteins are long thread-like proteins, right? That form the structural framework of the cell. Okay? Providing like support, or they are helping in the movement. Okay? So these are the filamentous protein. So blood clotting. What is blood clotting? Clotting is coagulation. right? So hemostasis is like stopping blood. Stasis means stop, hemo means blood, right? So prevent blood loss. What happen in hemostasis? It prevent blood loss, maintain the perfusion, right? Triggered by platelet aggregation, where like the platelets come aggregated, like come together. Okay, it will trigger that. And two pathways are there. We heard these pathways, but we are not very much like love to learn. In my time, like I always like forget this intrinsic and extrinsic pathway. Right, Shilpa? It's very volatile. Two pathways are there. First is intrinsic, that is triggered by changes in the blood, and the second is extrinsic, that is triggered by something occur outside the blood vessel. Okay, so something it happens inside, that is the word it also depicts, like it's in intrinsic, or what happens from the outside, that is extrinsic, right? So end result of the coagulation is blood clot, that is hemostasis. Understand in this slide everything? If I will ask anything, you can able to answer.
Yes, ma'am.
Good. So this is all like here clotting cascade. So Kavita, read this intrinsic pathway and try to explain. Where you will stuck, I will explain.
Intrinsic pathway, platelet
Yeah.
aggregations that leads to the factor 7. And ma'am,
There's,
that I actually all the clotting factors I don't know
but
because
this stimulate. Okay,
okay,
here what happened? This
factor
platelet
7 will
aggregation
stimulate the
stimulate the factor
factors.
7.
Sorry, ma'am. Factor 7 will stimulate the factor 7A.
No, it's 12. Not
12,
it.
ma'am.
Yeah, it's 12. It's
Okay.
10 and 2 lines, no?
Okay. Sorry.
Yeah.
And first also 10, 12, ma'am. Factor 12 plus factor 12A, ma'am, stimulated. And
What
factor
is
12
factor
is
12A?
12 is
This is the activated form of factor 12, right?
okay.
Wherever the A mentioned, it means it is the activated form of that factor. Okay, what happened? The platelet aggregation activates this factor, and this factor then aggravate the activated form of that factor, particular factor. Okay, now,
The factor 12A will stimulate the factor 11.
yes,
So what is the
good.
factor 11, ma'am? What will
These are the factors you can, when you go through, like in the deep study, you can open your books, you can see here, like these are the factors, these are all are the clotting factors. These are help to clot the blood. Okay, whenever we are give anti of any of these factors, then it will work as an anticoagulants. Okay,
yes, ma'am.
so what happened here? Like this activated factor 12 will then what it does, it stimulate the factor
11.
11. This factor 11 stimulate the factor 9,
Yeah.
and then factor 10, and then factor in the presence of calcium and
Platelets
platelets.
plus calcium.
Yes, so at the last, in extrinsic pathway and intrinsic pathway, right? In the these last factors always factor 10, and in the presence of calcium they work. Okay, you can see in the last, like you they mentioned in this chart that this platelets stimulate calcium, then factor 10, but actually what happened, this factor will work in the presence of calcium and platelets. Okay, understand Kavita, Shilpa, Prakavi, everyone? Like I can't see
Yes,
everybody,
yes,
but
ma'am.
yes, yeah, okay, wherever you not understand, just raise your hand. Okay, so what happens, you can see, Kavita, here
Yes, ma'am.
like factor 10, what happened till this is these three work together. Factor 10, platelets and calcium. The presence of under these two platelets and calcium, this factor 10 works, and then they stimulate the thrombin.
Thrombin.
Okay, this we can everybody we can, I know that maybe one or two not remember, but everybody remember these all last one. We forget always these upper one, upper factors, but this last we always learn, know, remember, right? This thrombin, then thrombin acts on convert it into fibrinogen, then fibrinogen convert it to fibrin, and at the end it become clot. Clot formation is there, right? This is how it works now. And the anticoagulants, Kavita, we are giving, they act on in this particular forms, like some are acts on thrombin or fibrinogen or fibrin. Okay, they stop their functions and work as an anticoagulant. Understand?
Yes, ma'am.
In some cases, in some disease conditions, okay, in particular situations, this is a very deep study. If you want, you can study these things also. Like we have to give some factor blockers, right? Where we need to coagulate the blood, right? We need to stop the blood through this blockage. Like if we are giving any anti fibrinogen or fibrin, we can stop the blood, right? But in some conditions we are giving this factor 11 or factor 9 antigens also, right? Antidote. Okay. And what happen in extrinsic pathway, suppose that any trauma occurs, right? The patient is bleeding, and what happen, the factor 7 will stimulate. Okay. Whenever in our body any trauma occurs outside our body, then factor 7 will stimulate. Okay. When factor 7 will stimulate, what happen? It will then, how it works, Kavita? Shilpa, come on.
Factor 7 will stimulate the platelets. Platelet will stimulate the calcium that leads to
No, no,
the.
no, no. I have already told you. Here you are wrong again. Okay. What happens in slide I have already told you. Then factor 7
Factor
stimulate
A
this
activate.
platelets. Yes, in the presence of calcium,
Calcium.
factor 10 will
Factor
work
10 will
and it
work.
will stimulate the
The thrombin.
Thrombin.
thrombin. Okay. Always, whenever anybody will question you, you have to answer like this. In the presence of calcium, this works. Okay. So then after on the last part, what happened? They will all together, like if any injury outside of either if it's any injury inside, then ultimately after the this on the step of factor 10, they will stimulate thrombin, and thrombin then convert it to fibrinogen, and fibrinogen converted to fibrin, and fibrin, after fibrin, what happens? The clot formation will be occur. Okay.
Okay.
Understand, everyone? I will explain you everything like in detail, right? But I need response from your side, right? Because like I love to explain the things, but you just respond me, okay? Whenever you feel like that, ma'am, we don't understand this, you just let me know. Okay, Shilpa,
Yes, ma'am.
you questioned me one question now on that day. Actually, my classes were going on, so I was really busy at the time. I hope you got the answer, na?
Yes, ma'am. I got the answer.
Okay, I messaged you. You just told me that, ma'am, I got the answer. Then I said, okay.
Yes, ma'am. I got the answer for it. Right.
Okay, okay. So accessory organs are kidney, okay, erythropoietin, and stimulates the production of erythrocytes in kidney, right? In spleen, what happen? thrombopoietin and control the thrombocyte productions. 20% of thrombocytes stored in the spleen, we know that, and it also breaks down old erythrocytes here in spleen. Okay, and liver helps in this clotting factors. Okay, so these three are the accessory organs for this system. This, I forgot the name of the system, hematology system. So these are the like anticoagulants. What do you understand by this anticoagulants?
Prevent the clotting.
They stop clotting.
Okay. Anything else? So anticoagulants are like heparin, and low molecular weight heparin. Okay, antiplatelet drugs like Plavix, clopidogrel, and aspirin, right? And next is warfarin or Kavita, as I have already told you, na, some are working on the particular factors. So these drugs are work on factor 10 activated form. Okay, these are the inhibitors of factor 10 activated form. You know, the last factor,
Yes, ma'am. Factor 10.
factor 10. So these are the inhibitors of that factor. They directly work on that. Okay, so these all are the anticoagulants. So first is heparin. Classification: indirect thrombin inhibitor, anticoagulant. How it works? Thrombin, this heparin, how it works? Thrombin converts fibrinogen to fibrin, and fibrin forms a, after fibrin, what happens? The form will clot, right? Fibrin forms clot now.
Yes, ma'am.
Then antithrombin, third inhibitor thrombin, and heparin enhances. What happened? Antithrombin third inhibits the thrombin. Then this heparin enhance. This heparin, how it works? It enhances the antithrombin third. Okay. This stops thrombin from being activated. It will stop the thrombin to being activated. The, the only activated thrombin can convert this to the fibrinogen, but this heparin acts on that and it stops the thrombin to being activated, which therefore prevent the clot formation. Okay, so this is in the intrinsic coagulation pathway. If something bleed inside our body, understand? So heparin always, like, end result is what, like mentioned here in the slide, like it slow down the clotting. Heparin, got it? Then basic information is like uses to prevent blood clots in stroke, in chronic fibrillation, and post-operatively. So how it works to prevent the clots? Like in strokes, we know that stroke happens due to clot formation, right? So this helps because it's inside the body. Everybody understand? Stroke inside the body, na? There is like nothing outside injury here. We know that the heparin acts on the intrinsic pathway. Understanding, everybody, but I am trying to say, Kavita,
Yes, ma'am.
understand, na? In
Yes, ma'am.
stroke, in chronic afibrillation, in these, like and something inside the body, right? Stroke formation
yes.
in stroke, or in that, in other cases like in a fibrillation, the clot formation inside the body, right? Not like here is no injury from the outside, right? So in this, we are prescribing to the patient like always heparin, right, in stroke, because the clot formation inside our body. And in chronic afibrillation, what happens? I'm sorry. देखो मेरा कितना जोर लग रहा है. Chronic afibrillation, what happened? Due to stasis of blood. Okay, because heart is not pumping properly, na? Somehow the blood will be stasis, right? So in this also, like we are prescribing heparin, right? Post-operatively. How post-operatively? Because the what
To
happened in
prevent
post-operative?
DVT.
Huh?
To prevent DVT. To prevent
Yes,
DVT.
very good, very good. Because the like activity will be decreased, right? But DVT can happen, like we also prevent the DVT also. The stasis will be there, clot formation will be there, and we are prescribing heparin to the patient to prevent the clot formation. Understand? Titration. What is titration? You're working.
Yes, ma'am.
What is titration?
It is actually it is tapering down some of the drugs. Anything. It's not only for the
Adjustment
heparin,
of the dose.
adjustment of the
Yeah.
drug.
Yeah. Adjustment of the dose, right? So, like client on the heparin drip, right? Chipa, are you messaging something?
She is traveling. She isn't traveling. That means she's going for duty. That's she messaged.
Okay, okay, right. I couldn't able to see the proper message, so that's why I asked. Thank you, Kavita. So clients on heparin drip have activated PTT level drawn every we have to like drawn every 4 to 6 hours to titrate the drip. Okay. So normal activated PTT is like 30 to 40 seconds. But if we are giving a therapeutic dose, then it should be double of the normal, or 1.5 by the normal. Okay. So if it's 30 to 40, it means approximately it should be 60 to 80. Understand? So this is the doses. Important nursing considerations are biggest side effects to monitor for bleeding, hematuria, like there will be a pink color, or like blood in urine, we can say. Hemapsis, like blood in vomit, okay, bruising, or epistaxis, right? So antidote will be protamine sulfate. We know that the antidote of the heparin is protamine
Protamine
sulfate.
sulfate.
Very good. So heparin induced thrombocytopenia and thrombosis, that is HITT, right? So heparin induced thrombocytopenia and thrombosis is like it's the complication of heparin therapy. Usually occurs 5 to 10 days after the heparin exposure. Okay. Suspects in any client on heparin who has an unexplained platelet drop. Right? Clinical manifestations are like the patient who are taking this, they have skin lesions at heparin injection site, where because they are giving subcutaneously, what happen on that particular site where they are injecting, the bruising will be there, or any scar will be there, or lesion will be there. Okay. Patient is temporarily feeling chills, fever, and some patients, we can see in some patients, dizzy and chest pain also. Okay. These are the clinical manifestation. Some complications will be there like DVT, deviant thrombosis, and pulmonary embolism. Okay. In treatment, what we can do, discontinue all heparin and start a different anticoagulant. If there will be any complication or the heparin is not suitable to the patient, then what happen? Ultimately we will discontinue the heparin and try to start a different anticoagulant. Understand here everything?
Yes, ma'am.
Good. So low molecular weight heparins. LMW heparins we are giving to the patients in ICU mostly, है ना Kavita? Because
Yes.
the patients are for like bedridden for the long time. There is no activity for the long time. That's why to prevent from DVT, we can say we are giving these LMW heparins. That the example of that is enoxaparin, dalteparin, and tenzaparin. Right? Therapeutic classes, anticoagulants, and indications are like to prevent the clot formation. Suppose that in the treatment of DVT, pulmonary embolism, and cerebrovascular accidents, right? Nursing considerations are always given subcutaneously. We know that all the anticoagulants we are always given subcutaneously, not interchangeable with the heparin. Okay. These porcine derived may have cultural or religious implications. Understand this porcine derived? Porcine derived means this much time you have taken. Porcine is pig. Okay, pig, like they are from animal. So that's why they have mentioned they may have cultural or religious implications. Okay. No need for anticoagulation test monitoring. Dose is based on the body size. Do not always monitor platelets. Right? We have to always monitor the platelets. Okay. And only anticoagulants that can be used in pregnancy. This LMW.